Vitamin D is the supplement where I hear the widest range of promises. Some people say it is mainly for bones. Some say it fixes immunity, mood, metabolism, hair, and almost everything else. If someone is just trying to be sensible, what is the first filter?
The first filter is, vitamin D is essential, but it is not automatically performance-enhancing in someone who already has enough. Its clearest job is helping the body absorb calcium and support bone mineralization. Deficiency can lead to rickets in children or bone-weakening problems in adults. So the best question is not, what miracle does it do? It is, am I low, at risk of being low, or treating a diagnosed problem?
So before we even talk dose, where does it come from? People call it the sunshine vitamin, but then they also buy capsules, fortified milk, or fish oil-looking pills. Are those all feeding the same pathway?
Yes, vitamin D from skin, food, or supplements enters circulation, then the liver converts it into 25-hydroxyvitamin D. That is the storage marker commonly measured in blood tests. The kidney helps convert some of that into the active hormone-like form, which then supports calcium and phosphate regulation. That pathway matters because a bottle label is not the same thing as active physiology.
When people say it is for bone health, that sounds almost too basic compared with the internet claims. But is that actually the strongest evidence, Lane?
It is the strongest physiology, but even bone outcomes need nuance. Public recommendations have not treated routine low-dose vitamin D, with or without calcium, as a universal fracture prevention fix for all community-dwelling adults. The practical meaning is narrower: prevent and correct deficiency, support people with bone risk contexts, and combine it with the rest of bone care rather than expecting one capsule to carry fracture prevention alone. The most likely beneficiaries are people with low blood levels or higher risk of low levels, older adults, breastfed infants, people with darker skin, limited sun exposure, fat malabsorption conditions like Crohn's or celiac disease, obesity, or history of gastric bypass. In those situations, testing and a targeted plan are often smarter than copying a generic dose from a forum.
If someone does need more, do they have to use a supplement? And I keep seeing D2 versus D3. Is that a meaningful distinction or just marketing language?
Very few foods naturally contain much vitamin D. Saltwater fish, egg yolks, and liver contain some, while many people get more from fortified milk, yogurt, or cereal. Supplements commonly use D2 or D3. Both raise blood vitamin D, but D3 may raise it higher and for longer. Because vitamin D is fat-soluble, taking it with a meal or snack that contains some fat can improve absorption.
The immune claim is the one I hear most. Take vitamin D so you do not get sick, or so your immune system works better. Is there a fair version of that claim?
A fair version is, vitamin D is involved in immune function, and some trials suggest possible disease-specific effects. In the Vital Autoimmune trial, adults taking 2,000 IU per day had fewer confirmed autoimmune diseases than placebo over about 5 years, with a hazard ratio around 0.78. That is interesting, but it is not the same as saying vitamin D prevents every infection or replaces medical care. Mood, metabolism, hair, and nerve-adjacent claims should be graded even more carefully. Low vitamin D can cluster with illnesses or lifestyles, but association does not prove the supplement fixes the outcome. In a depression trial, 4,000 IU daily was not superior to 400 IU daily over 6 months. For diabetes prevention and other metabolic claims, guidelines emphasize selective use in baseline context, not megadose optimism.
That makes it less like a feeling supplement and more like a status problem. So how would someone judge whether vitamin D is helping, especially if the goal is not something they can feel tomorrow?
Exactly. Typical recommended daily amounts are modest, 600 IU for many adults through age 70, and 800 IU for adults 71 and older, with different guidance for infants. Some people need more, but that decision should come from risk, labs, and clinician context. High-dose vitamin D is not something to guess because the harm signal is mostly about too much calcium in the blood.
Who should not treat this like a casual grocery store decision? I am thinking of people who already have kidney issues or calcium problems.
Right. People with kidney disease, high calcium, sarcoidosis, some cancers, or relevant medications should get clinician guidance before high-dose use. The clean takeaway is simple. Vitamin D is important, but it is most useful as a targeted correction, not a universal upgrade. Get sensible intake from sun-safe habits, food, fortified foods, or supplements when needed, and let blood status and medical context decide how aggressive to be.